when we think about health, our minds often jump straight to individuals, maybe our own health or our families.
Right.
But understanding the health of an entire community, that's a vastly more complex thing. It's a really crucial challenge. And it really crystallizes when you look at something like malnutrition, which, believe it or not, isn't just a straightforward medical issue.
It absolutely isn't. You see, nutritional problems are profoundly multifactorial. That's the key word.
Multifactorial.
Yeah, they're tangled up in areas you might not initially connect, like education levels, population demographics, farming practices, even rural development policies.
Wow.
Often they're really byproducts of deep-seated poverty and, frankly, systemic injustice.
Okay.
And what's really fascinating is why we need this comprehensive, sort of mini-angled approach here. It's the only way to get truly precise information, to pinpoint exactly where and how prevalent these issues are, and maybe most importantly, to identify the specific groups at the highest risk.
And that's really our mission for this deep dive, isn't it? Imagine we're like health detectives arriving in a community.
Yeah.
It's clearly struggling, but the full story isn't obvious right away. We're going to unpack the sophisticated toolkit experts use to meticulously piece together that story, like one crucial clue at a time, to really understand the health of a whole population. So let's zero in on that core challenge first. The profound impact of malnutrition. It's not just about, a lack of food. It echoes through public health.
Absolutely.
It ripples into socioeconomic development, and frankly, it touches every single part of a community.
It truly does, and this is precisely why an integrated assessment is so vital. It's like looking at the entire lifespan of a problem.
Okay.
From the very earliest stages, what we call the pre-pathogenic period.
Right.
That's even before someone feels sick or shows obvious signs.
Right before symptoms even show up.
Exactly. All the way through to the actual illness and its long-term consequences. This whole view, this holistic view, is absolutely fundamental for clearly defining problems, for crafting effective policies, and crucially for evaluating whether our healthcare programs are actually making a difference on the ground.
Okay, let's unpack this then. So if we're these health detectives, how do experts actually gather this precise, multifaceted information out in the field? What's like the first tool in their kit?
Well, one of the most fundamental and actually surprisingly practical methods is the clinical examination.
Clinical examination.
Yeah, this basically involves observing physical signs and symptoms on individuals within a community. It's really about what you can see with the naked eye.
So you're talking about looking for very specific visual clues on someone's body. Can you give us a sense of what kind of physical signs you'd be looking for?
Exactly. We're looking for well-recognized signs that point to specific deficiencies. For instance, things like angular stomatitis, those cracks you sometimes see at the corners of the mouth, or BTOT spots, which are specific lesions in the eyes.
Okay.
Those can be clues for vitamin deficiencies. Or even, say, calf tenderness, sometimes related to beriberi, or a significant thyroid enlargement.
Ah, goiter.
Right, a clear sign of endemic goiter from iodine deficiency. What's surprising is that these simple observations, sometimes overlooked today, can still catch widespread issues, especially where more complex tests aren't available.
That makes a lot of sense. But I imagine there are limits to just observing, right? Like you can't tell how much someone is malnourished just by looking.
That's a key limitation, definitely. Clinical examination cannot quantify the degree of malnutrition.
Okay.
Plus, many deficiencies don't actually present with visible physical signs,
Yeah.
And the subjective nature of some observations can unfortunately lead to errors.
So how do you manage that subjectivity?
Well, to minimize these issues and ensure consistency, health workers typically use standardized survey forms. It helps keep everyone on the same page.
Okay. So beyond what we can see on the surface, where do we go next for more detailed insights? I guess that brings us to anthropometric measurements.
Exactly.
Which sound technical but are incredibly valuable, especially for young children, right? They reflect patterns of growth and development, giving us actual, tangible data.
That's right.
We're talking about measurements like weight, height or length, skin fold thickness, arm circumference. For infants, they'll even measure head and chest circumferences. And what's great, I suppose, is that non-medical personnel can actually collect this data with the right training.
Yes, and these simple measurements translate into incredibly powerful indices. There are 3 commonly used ones that tell us very different things.
Okay, what are they?
So first is weight for age, or WFA. This tells us if a child is underweight. It's a kind of composite measure.
A mix of things.
Yeah, it reflects both chronic and acute issues, stunting and wasting. It's really excellent for tracking overall changes in malnutrition levels over time in a population.
Okay, one down.
Then there's length for age, or height for age, HFA. This specifically identifies stunting.
Stunting, that's the long-term one.
Exactly. It indicates chronic, long-term malnutrition, often a sign of prolonged nutrient deficiency or recurrent infections.
Got it. And the third?
The third is weight for length, or weight for height, WFH. This identifies wasting.
Wasting, that sounds serious.
It signifies acute malnutrition. It means a child has recently lost weight or failed to gain it, often due to a recent illness or maybe a food shortage. It's a sign of a more immediate problem.
So how do they make sense of these numbers? It's not just the raw weight or height, is it? You mentioned indices.
Right. These indices are often expressed in what are called Z-scores.
Z-scores.
So think of it like this. It's a way to see how far a child's measurement deviates, how many standard deviations it is away from the median or average of a healthy reference population.
Ah, like comparing to a benchmark.
Exactly. It's almost like a standardized percentile rank, but statistically more robust. And this allows for classification into moderate or severe malnutrition.
Can you give an example?
Sure. So, for instance, a child whose weight for height Z-score is very low, say more than 3 standard deviations below the median, which often corresponds to less than 70% of the expected weight for their height, that child would be considered severely wasted.
Oh, okay, that makes it clearer. And where do these reference populations come from?
Well, for the reference values, the WHO Child Growth Standards are generally accepted globally for children up to 5 years old.
Why up to 5?
The thinking is that in that age group, genetic and ethnic factors have a relatively minor influence on growth compared to environmental factors, assuming similar socioeconomic conditions and health support.
Interesting.
However, it's worth noting that some regions, like India, for example, have also developed their own national reference standards, like those from the Indian Council of Medical Research, or ICMR. These are based on observations of well-nourished, healthy children within their own population.
Right. And here's where it gets really interesting, I think, connecting this data to action, growth monitoring.
Yes, very important.
This is especially vital for kids from birth to 5 years, using those familiar growth charts you see in clinics. It involves serial weighing, right? Not just a one-off measurement, but tracking over time to detect growth faltering.
Which is often the earliest sign.
The earliest sign of protein energy malnutrition, yeah. And what's crucial to understand, I think, is that the direction of growth on a child's chart, whether it's steadily moving up, flattening out, or even dropping, that's often far more indicative of a child's health than any single point measurement.
Absolutely. It's about the trend, the story that line tells over time.
Exactly. So we've got observation, we've got physical measurements. What's next? Deeper still.
Deeper still.
Oh.
Beyond what we can see or measure physically, laboratory and biochemical assessment methods offer even more precise measurements.
Ah, the lab tests.
Right. They can even detect malnutrition in its preclinical stages, so before any overt symptoms or physical changes actually appear. This is where we get into the, let's say, microscopic clues.
Okay. So what kind of lab tests are we talking about here, and what crucial insights do they give us?
Well, hemoglobin estimation is probably one of the most important in nutrition surveys.
For anemia?
Exactly. It gives a great indication of overall nutrition and helps diagnose nutritional anemia, which is a huge global problem.
Yeah.
And simple stool examinations can identify intestinal parasites.
Which can make malnutrition worse?
Precisely. They often complicate and worsen nutritional status, so that gives us vital background information.
And the biochemical side?
On the biochemical side, these tests involve measuring individual nutrient concentrations in body fluids, like checking for serum retinol, which is vitamin A in the blood.
Okay.
Or serum iron levels to detect iron deficiency. Or they might detect abnormal amounts of metabolites in urine, like urinary iodine levels, to check for iodine deficiency disorders.
So these tests offer real precision, but what are their limitations for a big community-wide assessment? They sound expensive.
That's a major limitation.
Yeah.
They can be time-consuming and quite expensive, yes.
Right.
This often restricts their large-scale application. You might only test subsamples of the population, not everyone.
Okay.
And critically, they mainly reflect current nutritional status. They don't necessarily tell you about long-term trends or past deficiencies.
Okay, so they're a snapshot in time.
In a way, yes.
Building on that, you mentioned functional indicators earlier. That sounds like an emerging area.
It is. It's an emerging class of diagnostic tools. And they're really interesting because they complement those static biochemical indicators.
Oh, so?
Instead of just telling you what nutrient might be low, they try to assess the practical implications of that nutritional status. It's about seeing how the body is actually functioning.
Ah, like, is the machinery working properly?
Precisely. That's a good way to put it.
Yeah.
They show us the impact.
Can you give some examples? What kind of functions are we talking about?
Sure. So tests might look at structural integrity, like erythrocyte fragility, which relates to vitamin E or selenium, or host defense.
Immune system.
Yeah. Immune function, like leukocyte chemotaxis, which can be impacted by protein, energy, or zinc deficiencies, or hemostasis blood clotting, like prothrombin time for vitamin K.
Wow.
Even things related to reproduction, like sperm count for energy, or zinc, or nerve function.
Nerve function, like what?
Like how well someone's eyes adapt to darkness.
Yeah.
That can reveal vitamin A or zinc issues sometimes, even before a blood test flags it as critical. Or even work capacity, looking at heart rate response during exercise, which relates to protein, energy, and iron status.
So it's really about the real-world effect of nutrition.
Exactly, seeing if the body can do its job properly.
Okay, that makes sense. Now let's switch gears slightly. Let's talk about what people actually eat. Assessment of dietary intake or dietary surveys. They must provide invaluable insights into food consumption patterns, right?
Absolutely. It's a crucial piece of the puzzle, definitely. It supplements all these other assessment methods we've discussed.
How do you actually do that? How do you find out what a whole community is eating?
Well, there are different ways to gather this information. A common method, particularly in places like India, is the weighment of raw foods.
Weighing raw food.
Yeah. It involves meticulously weighing all the food that's going to be cooked, what's actually eaten by the family, and even the waste, usually over a period like, say, 7 days to get a good average.
That sounds incredibly detailed.
It is. Then there's the weighment of cooked foods. This is sometimes less acceptable culturally, but it does allow analysis of food exactly as it's consumed.
Good. Any other methods?
Yes. For larger populations, the oral questionnaire method is very useful.
Just asking people.
Essentially, yes.
Yeah.
You gather retrospective information, asking people to recall what food they ate over the previous 24 or maybe 48 hours. Relies on memory, of course.
Right. Recall can be tricky. So once you have all that data, weighed food or questionnaires, what do you do with it?
That raw data is then translated. Using food composition tables, databases that list nutrient content, you can calculate the average intake of different food groups and specific nutrients like protein, vitamins, minerals.
And that information is incredibly practical, isn't it? I mean, you can use it for planning health education programs.
Absolutely.
And even assessing needs in areas like agriculture and food production for the community.
Exactly. It connects dietary patterns to broader planning needs.
Okay. And we also can't overlook vital and health statistics, right? Things like birth and death rates.
Definitely not. The analysis of mortality, death rates, and morbidity illness rates data is absolutely crucial.
Why crucial?
Because it helps identify high-risk groups within the population and really understand the extent of nutritional risk to the community at that macro level.
That makes sense. So what specific indicators are we looking at here that are heavily influenced by nutrition?
Well, we're talking about indicators like the infant mortality rate, or IMR.
Right.
That's universally recognized as just critical for understanding children's health status and also the overall level of the social environment.
Okay, what else?
Other indicators include the second-year mortality rate deaths between age 1 and 2, the prevalence of low birth weight babies.
Which is a big indicator.
A very big one, yes. And even the community's overall life expectancy.
And illness data. Morbidity.
Yes, morbidity data on illness, especially concerning things like protein energy malnutrition, PEM, anemia, nutritional blindness, that provides extremely valuable information about the actual health burden in the community.
But I guess mortality data alone doesn't give the full picture.
No, it's important, but it won't give you a complete picture of a population's nutritional status by itself.
Yeah.
It tells you about the fatal outcomes, but not necessarily the full spectrum of malnutrition.
Right. Okay, finally, we come to ecological studies. This is where we sort of zoom out, right? Look at the bigger picture, the environmental and societal factors influencing health. It feels like this is where we really start to maybe solve the deeper mystery behind why malnutrition exists in a place.
I'd argue these studies are perhaps the most crucial in some ways. because they help us understand that truly multifactorial nature of malnutrition we mentioned at the start. It's often called a man-made disease for a reason,
Man-made.
meaning it's deeply rooted in societal structures, socioeconomic conditions.
Okay, so what factors do you examine in these ecological studies?
Well, we examine things like the food balance sheet. That's an indirect method, estimating the per capita food supply available in a country. Useful for national-level general patterns.
Okay, the big picture supply.
Right. But then we dive into crucial socioeconomic factors. Things like family size, occupation, income levels, parental education, local customs, cultural food patterns.
All the things that affect choices and access.
Exactly. All of which significantly influence food consumption choices and availability at the household level. We also look at the presence and, importantly, the utilization of health and educational services.
Like clinics and schools.
Yes. Is there primary health care available? Are there feeding programs, immunization programs? Are people actually using them?
Right. And what else?
And finally, what we call conditioning influences. These are things like parasitic infections, bacterial infections, viral infections.
Things that make malnutrition worse or trigger it.
Very often, yes. They frequently precipitate or worsen malnutrition, especially in vulnerable children. So, putting all this together, making an ecological diagnosis of how these interacting factors play out. That is absolutely essential if you want to plan effective prevention and control measures.
Yeah.
It's really about connecting the dots between individual health and the wider environment they live in.
That's a massive amount of information, all these different angles working together. Now, just to be crystal clear for everyone listening, there are two related but distinct concepts that sometimes get confused: growth monitoring and nutritional surveillance.
Oh, yes. Good distinction to make.
How do they differ in our sort of health detective work?
They're definitely complementary, but they serve different purposes. Growth monitoring, as we discussed with the charts.
Right, the individual charts.
It focuses squarely on the individual child. It's about dynamically assessing their health, promoting their continued growth, primarily through that regular weighing and plotting. It's personalized care, essentially.
Okay, individual focus.
Nutritional surveillance, on the other hand, is carried out on a representative sample of children across an entire community or region.
The bigger picture again.
Exactly. Its purpose is different. It's to diagnose malnutrition at a broader population level, to assess overall trends across that population, and to evaluate the impact of interventions like a feeding program on a larger scale.
And what indicators do you use for surveillance?
Indicators for surveillance would include things like average birth weight, breastfeeding rates, overall child mortality rates, and of course, aggregated anthropometric measurements from that sample population. It's about the health of the group, not just one child.
Got it. So growth monitoring for the individual, surveillance for the population trend.
You've got it.
So after exploring all these methods, what does this all mean for us trying to understand community health? It's clear that a truly comprehensive assessment of nutritional status isn't about picking just one method.
No, not at all.
It requires the powerful integration of all these approaches: the clinical observation, the anthropometric measurements, the biochemical tests, the functional indicators, the dietary surveys, the vital statistics, and those crucial ecological studies.
Absolutely. Each method offers unique insights. Think of them like different lenses on a camera or different tools in a toolbox. Each provides different clues.
Right.
And their combined use provides a far more complete, more nuanced health profile of both individuals and the community as a whole. This holistic understanding is truly fundamental.
Fundamental for what, specifically?
Well, fundamental for defining the problems accurately in the first place, for identifying those groups most at risk, for setting priorities because resources are always limited, and ultimately for developing and then evaluating effective strategies to combat this really complex and persistent challenge of malnutrition.
It really paints a picture of needing a very integrated view, which raises an important question, maybe for you listening. If we applied such a holistic, integrated diagnostic framework, this many-angled approach we've been talking about, to other complex societal challenges, not just health, but maybe things like economic disparity or educational outcomes or even environmental issues, what new, maybe surprising insights might we uncover about their true roots and perhaps find pathways to truly effective solutions? Something to mull over until our next deep dive.